Serious question, doc. Why does our society put so much importance on preventing that? This patient was a horrible person. Why should we as a society demand they live and take responsibility for them? So on this video that this comment is talking about, I described a situation in which I had to assess for suicidality in a patient who was convicted of harming children. And I was talking about how I manage my feelings in that kind of difficult situation. So I think it would be really helpful to just look over what medical ethics has to say. There are 4 principles in medical ethics that doctors ought to follow. The first is beneficence, which is acting within the best interest of the patient. So it's not always the most life-prolonging thing, it's not always the most comfortable thing, it is what the patient wants with their consent and also what's good for them. Logically, what follows is non-malfeasance, right? Not causing harm to the patient. An example of this would be, and this is actually a big thing in medical ethics, is if a patient who has a working limb wants to get the limb amputated. There's no illness with it, there's no disease with it, that's what they want. Some would argue that you are violating non-malfeasance because you are causing harm to somebody. Justice, but not legal justice. Justice with respect to making sure things are distributed with equity and equally. So, if my mother came to the hospital and somebody else's mother was at the hospital, it would be a violation of justice to spend all of my time and my resources and my energy to take care of my mom, but not somebody else's mom. And it would also be a violation of justice if I withheld treatment or resources to a patient that I did not like, because maybe they're a bad person. And the last one is autonomy, respecting the patient's right to make their own decisions. Now, you could probably think of different situations that would cause these 4 principles to be at odds with each other. 1, because people have different opinions on many things, but 2, because there's no such thing as like the best course of action. It always is the context of what's going on with the patient. This is a very brief introduction to medical ethics and at least the basic principles that physicians and other healthcare providers should be going by when dealing with ethical issues. Let me know if you have any specific questions.